Magandang umaga. This lecture is for arterial blood gas interpretation. For us to interpret the arterial blood gas results, you need to remember the following values. pH 7.35 to 7.45. Partial pressure of carbon dioxide 35 to 45 mm mercury. Bicarbonate 22 to 26 milliequivalent per liter. Try to memorize these values. You may pause the video to memorize these values. There are a lot of ways for us to interpret arterial blood gas results. This lecture simplifies this to 4 simple steps. First, to determine if this is acidosis or alkalosis. Second, to determine if it is a respiratory abnormality. Third, to determine if this is a metabolic abnormality. And fourth, to determine if what type of compensation occurs. Will it be F, fully, P, partial compensation, and N, no compensation at all. Again, recall the 4 steps. Will it be acidosis or alkalosis? Will it be respiratory? Will it be metabolic? And what type of compensation occurs? Will it be full compensation, partial, or no compensation at all? The first step is for us to know if it is acidosis or alkalosis. How do we go about with this? Recall that the normal value of pH that you have just memorized is 7.35 to 7.45. If the value of the pH is lower than 7.35, it is referred to as acidosis. Again, if the value of the pH is less than 7.35, you are sure that the condition that your patient is going through is acidosis. If the pH of the patient is 7.45 and above, you are sure that the patient is going through alkalosis. Again, if the pH is above 7.45, it will be alkalosis. Next, will it be a respiratory problem or a metabolic problem? For us to understand if it is a respiratory or metabolic problem, you need to determine that for you to know if it is respiratory, you will be looking at the values of PaCO2. Okay, respiratory, so you'll be looking at the values of carbon dioxide. If this is a metabolic problem, you will be looking at the values of bicarbonate or HCO3. Again, respiratory, you will be looking at the values of carbon dioxide. For metabolic problems, you'll be looking at the values of bicarbonate. Now, let's know a new acronym, which is ROME. R-O-M-E. It says that for you to know that it is a respiratory problem, the arrows should be opposite. For you to know that this is a metabolic problem, the arrows should be pointing on equal or the same direction. ROME stands for respiratory, opposite, metabolic, equal. Now, applying that concept, we know that in respiratory, you will be comparing PaCO2 with the pH. So once the PaCO2 is pointing downwards, and then the pH is pointing upwards, you are sure that this is a respiratory problem. Or vice versa, if the PaCO2 is pointing upwards and the pH is pointing downwards, you are sure that this will be a respiratory problem. On the other hand, for us to know if this is a metabolic problem, you would be comparing the bicarbonate levels with the pH levels. If you have seen that the bicarbonate levels is pointing downwards and then the pH is also pointing downwards, you are sure that this will be a metabolic problem. If you can see that the HCO3 is pointing upwards and then the pH is pointing upwards, this is a metabolic problem. Now, the type of compensation. For us to know that something or the ABG result is fully compensated, the pH is normal. Again, for us to know if the ABG is fully compensated or if there is full compensation, the pH should be in normal range. If it is not in normal range, you need to evaluate if this is a partial compensation. For us to know that this is a partial compensation, just think of it like this. If your problem is bicarbonate if HCO3 is decreased, okay, and then pH is decreased, for us to know that there is compensation, the PaCO2 is also decreased. This means that there is partial compensation. Okay? In other words, if the arrow of the HCO3 and the PaCO2 is pointing in the same direction, partial compensation is what is experienced by our patient. If the arrows are not the same, you will be evaluating if there is no compensation at all. For us to say that there is no compensation at all, the value of the other substance involved, in this case your PaCO2, is normal. If it is normal, there is no compensation that is occurring. If it is normal, there is no compensation that is occurring. Let us try to understand compensation. Let's have the previous example. I said that if the problem is bicarbonate, for example, the bicarbonate is decreased and the pH is also decreased, we are expecting the PaCO2 to compensate for this one. Okay? Applying the concept of ROME, we know that this is a metabolic problem. In this case, since the pH is decreased, this is metabolic acidosis. Since this is metabolic acidosis, what would you expect? Okay, take note, this is an acidic state. Okay, you write on the side that this is an acidic state or acid. For us to compensate an acidic state, okay, we need to have an alkaline environment. Okay, in that case, PaCO2. Recall that I equate CO2 to acid. We equate CO2 to acid. If PaCO2 would want to compensate, quote unquote, your PaCO2 should be decreased. Your PaCO2 should be decreased because this will induce an alkaline state for your patient. Okay, because again, we equate carbon dioxide to acid. Since the condition of our patient is already acidosis, PaCO2 should be decreased for us to know that there is partial compensation. We can only say that the compensation is full, okay, or fully compensated or wholly compensated once the pH value already returned to normal. On the other hand, okay, if the PaCO2 value is only normal, we can say that there is no compensation. Why? PaCO2 did not do anything, quote unquote, okay, to augment or to correct the acid-base imbalance. Now, I think we are ready to apply what we have just learned. Let's have simple examples. First, 7.46. What will be the first step? Determine if this is acidosis or alkalosis. It helps if you will be placing arrows. pH is 7.46. Hence, the arrow is pointing upwards. Since the arrow for pH is pointing upward, this is, okay, good. This will be alkalosis. Next, PaCO2. The PaCO2 normal value is 35 to 45. In this case, it's 28. Is it increase or decrease? This will be decrease. Now, it's about time for you to apply your ROME. Respiratory opposite, metabolic is equal. Are the arrows opposite? Yes, it is. So you are ruling out a respiratory problem. Okay? This is a possible respiratory problem. Next, HCO3. Recall that the normal value of your HCO3 is 22 to 26. This is normal. Now, will this be a metabolic problem? Applying ROME, will this be a metabolic problem? In this case, for it to become a metabolic problem, the arrow should be pointing on the same direction. Is the arrow of pH and HCO3 pointing on the same direction? It's not. So this is not a metabolic problem. Now, let's determine the levels of compensation for the fourth step. So the levels of compensation should be F, P, N. Okay, let's start first with F, fully. We will only know, or we will only say that it is full compensation if pH is normal. Is pH here normal? It's not, so it will not be full compensation. We can only say that it is partially compensated if the direction of your PaCO2 and HCO3 is pointing on the same direction. Okay, in this case, PaCO2 is pointing downwards, HCO3 should be pointing downwards for us to say that there is compensation. Is it pointing downwards? In this case, it's not. So there is no partial compensation. Now, the last check. Will there be no compensation? As you can see, HCO3 is normal. Hence, there is no compensation. If you will be asked to give the full interpretation of these ABG values, that will be respiratory alkalosis without compensation. Again, that will be respiratory alkalosis without or with no compensation. Let us proceed to the second example. Now, determine pH 7.33. Let's place the arrows. Is this up or down? In this case, this is decrease. Hence, the condition is acidosis. PaCO2. Is this up or down? Normal value is 35 to 45. This is decrease. Hence, is this a respiratory problem? For us to know if this is a respiratory problem, are the arrows opposite for the pH and PaCO2? No, the arrows are not opposite, so this is not a respiratory problem. Bicarbonate, 12. Is this increase or decrease? The normal value is 22 to 26. This is decrease. Now, is this a metabolic problem? For us to know that this is a metabolic problem, the arrow should be equal or pointing on the same direction for both the pH and HCO3. Are the arrows pointing on the same direction? Yes, they are. So this is considered to be a metabolic problem. Fourth step, let us determine if this is fully compensated, partially compensated, or no compensation at all. For us to know if it is fully compensated, the pH should be normal. Is the pH normal? No, this is not full compensation. For us to know if this is partially compensated, the arrows of bicarbonate and PaCO2 should be pointing in the same direction. Are they pointing in the same direction? Yes, they are. So this is partial compensation. Let us just recheck. For us to say that there is no compensation, what should be the case? In this case, since this is a metabolic acidosis problem, it should be the PaCO2 that should be compensating. Okay, in this case, we need to check if the PaCO2 is normal. Is PaCO2 normal? It's not. So we are sure that this is not a no compensation, quote-unquote, case. So the full interpretation for this one will be metabolic acidosis with partial compensation. Again, it will be metabolic acidosis with partial compensation. Let us try to have more examples. Third example, pH is 7.46. Is this acidosis or alkalosis? Again, go back to placing the arrows. This will be up. Okay, this is increase. Is it acidosis or alkalosis? Yes, it is alkalosis. PaCO2, 30. Is this up or down? This should be pointing downwards. It's decrease. Hence, is this a respiratory problem? What do? We check if the arrows are opposite. So yes, this is a respiratory problem. HCO3, 21. Is this increase or decrease? It is decrease. Now, we need to check if this is a metabolic problem. We need to compare the arrows of the pH and bicarbonate. Are the arrows equal or pointing in the same direction? No, they're not. So this is not a metabolic problem. We now know that we are facing respiratory alkalosis. Let us determine the type of compensation. Is this a full compensation? Is pH normal? No, it's not. So this is not a full compensation. Is this a partial compensation? Since this is respiratory alkalosis, we will be looking at bicarbonate. Are the arrows of PaCO2 and bicarbonate the same? Yes, they are. So this is a partial compensation. Now, we just need to confirm. Will it be no compensation? For us to say that this is no compensation, we will be checking the bicarbonate levels if it is normal. Is it normal? Obviously, it's not. So, we are sure that this is not no compensation. So, the full interpretation for this one is respiratory alkalosis with partial compensation. Let's proceed to the fourth example. pH is 7.48. Increase or decrease? This is increase. Is this acidosis or alkalosis? This will be alkalosis. PaCO2 is 50. Increase or decrease? This is increase. Is this a respiratory problem? Are the arrows opposite? They're not. So this is not a respiratory problem. HCO3 is increase. Now, is this a metabolic problem? If I will apply Rome, we know that metabolic should be pointing on the same direction. Are the arrows pointing on the same direction? Yes, they are. So this is a metabolic problem. Now, quickly saying the types of compensation. What do you think is the type of compensation? Since we have metabolic alkalosis, who should be compensating? Should be carbon dioxide. And for carbon dioxide to compensate, its arrows should be on the same direction, or its arrow should be in the same direction with bicarbonate. Is it on the same direction? Yes, it is. So this is a partial compensation. Metabolic alkalosis, partially compensated. By this time, you should be able to determine the ABG interpretation already. To the last step, or to the last example, I mean. pH is 7.44. The normal value of the pH is 7.35 to 7.45. So, what is our interpretation for this one? 7.44. It falls within normal range. Okay, this is normal. However, we need to know if it is acidosis or alkalosis. In cases like this, we use the midpoint as the point of reference. In that case, 7.4. Because 7.4 is between your 7.35 to 7.45. In this case, it says 7.44. Is it increase or decrease? In reference to 7.4, I can say that 7.44 is increase. Is this acidosis or alkalosis? This will be alkalosis. Good on that. PaCO2, 49. Is this increase or decrease? Increase. Now, is this a respiratory problem? Nada. Okay? Because the arrows are pointing on the same direction. So this is not a respiratory problem. Bicarbonate, 32. Increase or decrease? It is increase. Is this a metabolic problem? Checking on the bicarbonate and the pH arrows. Are they pointing in the same direction? Yes, they are. So this is metabolic. Now, types of compensation. Is this a full compensation? For us to know if it is full compensation, is the pH within normal range? It is. So this is fully compensated. Okay? Your interpretation would be metabolic alkalosis with full compensation. Again, that would be metabolic alkalosis with full compensation. This is an example of a fully compensated ABG imbalance. So due to the compensation being done by your carbon dioxide, the pH levels were able to normalize. If we are going to look deeper into that, remember our problem that is persistent is metabolic alkalosis. Since it is alkalosis, how do we compensate with alkalosis? We need an acidic state. And since our problem is metabolic, who will be compensating? It will be carbon dioxide. So, for us to compensate to that problem, what will happen? The carbon dioxide should increase. Because again, carbon dioxide is equivalent to acid. Okay? Hence, we have the respiratory compensation. In other words, if your patient is having metabolic alkalosis, what will your lungs do? Your lungs will try to conserve carbon dioxide. Your lungs will try to preserve carbon dioxide just to increase your carbon dioxide levels and to increase the acidity of your blood. Thank you very much for your kind attention.